I am from Hatay Mustafa Kemal University, Health Science Faculty from Turkey, and I am working with patients with multiple sclerosis. As most of you know, multiple sclerosis is a lesion that spread to brain and spinal cord. And sometimes we saw problems in motor, cognitive, or neuropsychiatric symptoms. Sometimes most of these symptoms are seen in one patient. Sometimes only one of that symptoms we see. And cognitive impairment is a challenging problem because it affects the patient economically and socially, and about 50% of the MS patients have cognitive problems. A picture from my country. Mostly cognitive dysfunctions such as memory, attention, executive functions, speed of information processing, language ability, and visual spatial abilities are affected negatively in multiple sclerosis. Mostly we say there are no predictors for cognitive impairment, but we know that if the disease duration is longer, the patient may have cognitive problem more than other. Disease subtype, race, sex, and cognitive disorder may play a role in cognitive impairment. For example, patients with progressive subtype of MS have more cognitive impairment than, for example, relapsing remitting type. And we know that there are many factors that cause cognitive decline, such as psychiatric disorders, sedative antidepressant medication, metabolic dysfunctions, fatigue, emotional disturbances, substance abuse, age, and quality of life problems cause cognitive decline in multiple sclerosis patients. And this mosaic from my city, from Hatay, and it has been found newly, and it means be cheerful and live your life. And we know disability and cognitive dysfunction not always develop parallel in multiple sclerosis, and mostly history of MS as well as lesion volume and location in the brain play a role in cognitive impairment. Cognitive fatigue is an important factor that play a role in cognitive impairment because unmanaged fatigue worsens cognitive challenges. Fatigue and cognitive fatigue is an important factor that clinicians should consider while planning treatment of the patient. And in cognitive impairment assessment, we may use many different scales or softwares, especially symbol digit modalities test is the mostly used test, and depression, another factor that's important in cognitive impairment. So scales such as big depression inventory may be used for assessing. And software such as processing speed test, computerized speed cognitive test may be used in cognitive impairment assessment. Why cognitive impairment examining is important? We make examining to notice deficits in attention, processing speed, memory, and learning and performance of everyday functional tasks, and for remedial interventions. This picture from Trabzon, Turkey. Why to diagnose of cognitive deficits? Because we should inform people with MS, family members, healthcare providers, and school personnel that patients with MS may have cognitive impairment. But we have some problems that cause not to diagnose as much as we want in that patients, such as insufficient numbers of adequately trained clinicians to offer screening, assessment, or remediation, and insufficient financial resources because some softwares are with price, not free, and when we want to use for cognitive impairment assessment them, we need some financial resources, and we need trained clinicians. And what about the impact of cognitive deficits on daily functioning and quality of life? There are, it causes many problems in MS patients' lives, such as work, school, activity participation, coping, and on quality of life. For example, in teenagers, in small children, it causes academic difficulties, including grade retention, social challenges, depression, and behavioral problems. Cognitive impairment at diagnosis predicts a change in vocational status 7 years later. In adults, cognitive impairment causes job loss in adults, and this is a big problem because of job loss. MS patients live many economical and social problems, and this causes more depression, and depression causes more cognitive impairment. And the driving is a problem in MS patients. Thalamic brain atrophy predicts number of motor vehicle violations among people with MS compared to healthy controls. And we know that MS patients have bad scores on the driving function test and have a higher risk of accident because of cognitive problems. And MS patients are less able to make informed decisions about their treatment. They cannot control their treatment, and so they have poor adherence to treatment according to other patients, and their money management skills reduced, and parallel to their disability, caregivers' burden increase. The disability is higher if the cognitive impairment is higher. The burden of the caregivers increase, especially cognitive dysfunction is an important cause of burden on caregivers. A picture from Istanbul. And what about the time perception in MS? I mostly work on that subject in the last time. Time perception and measure are essential components of cognition, behavior, and motor performance, representing one of the basic mechanisms of cerebral function. There is a bidirectional relationship between time perception and emotion. We have internal clock. Every person have internal clock. What does it mean? Internal clock, we know without looking at our hour, what's the time, and we may plan ourselves. We may control ourselves according to our internal clock. Time perception is received according to the sum of both cognitive process and environmental change, especially climate, day and night, and cognitive process assess the time perception in people. Brain areas such as frontal cortex, basal ganglia, parietal cortex, cerebellum, and hippocampus are the responsible areas for time perception. Time perception is an unconscious process that shapes personal social experiences and helps individuals to organize, clarify, and assign meaning to the events, and subjective experiences influence the perception of the passage of the time. For example, if we are boring, we feel that the time don't pass. But if we are cheerful and in an enjoyable event, we feel that the time is flying. So subjective experiences, emotions affect our time perception. There are some factors that may affect time perception, such as culture, religion, family modeling, education, socioeconomic status, and career, economic, political instability, experiences with drugs, traumatic events, and personal success affects person's time perception. Cappadocia from my country. And what did we measure in our study? We want to make a study to examine time perception impairment in multiple sclerosis patients. Yes, we know it should be time perception because there is cognitive impairment in most of multiple sclerosis patients. But there is no study that examined time perception in MS. So we conducted this study and we want to promote awareness of and attention to cognitive impairment in multiple sclerosis patients. So we conducted this study. And what we did, we included 60 MS patients and 60 age-matured healthy people to make comparison of time perception in between MS patients and between healthy people. We conducted two tests such as estimation and production test. Two tests starts with start command and estimation tests stopped by the examiner, but the production test was stopped with the patient. We used three different time durations, such as 7 seconds, 32 seconds, and 58 seconds. And we repeated each time duration test 3 times. I will open here a video about time estimation test. Yes, this is the test procedure. I open an online chronometer in front of me, and the patient sitting there, and I want the patient to count from inside, from internal clock, not with digits, not with tongue, or not with the moments. I want him to count only by internal clock. And when I said to him start, he started to count from his inside. And when I said to him to stop, I asked him how many minutes passed. You may see a test here. I said him to start when the time starts. And when I came to 7 seconds, I said him to stop and to say me how many seconds passed. I repeated it 3 times and made the test for 7 seconds, 32 and 58 seconds. In the estimation test, I wanted the patient to start and to stop. But in production test, I wanted the patient to start to count from inside him, internal clock, and wanted him to say me when he think that, for example, for 7 seconds, I said to him, when you come to 7 seconds, say to me 7. And I will examine him with the online chronometer. He's starting to count from his inside, and when he thinks he has came to 7 seconds, he says me it's 7, and then I will record his result and the chronometer's results, and then I will make comparison with healthy people. And our exclusion criteria was having hearing loss, dementia, or mental disorders. We excluded that patient and the patient that have relapsing remitting MS, ages older than 18 years, and native language Turkish, we included them. And as results, you may see here results of the estimation test. We repeated for 7 seconds, 3 times, first assessment, second and third assessment. For all of the time duration, we repeated it 3 times. And you may see here MS patients results and here healthy control patients results. As you see, for example, for 7 seconds first assessment, the patient's result was 13.81, but the healthy control people's result was 7.61 seconds. And this means multiple sclerosis patients' time estimation is higher than the normal. And you may see here a significant difference between multiple sclerosis patients and between healthy control patients. And let's have a look for 32 seconds first assessment. In MS patients, you may see 49.15 seconds, and in healthy control people, 32.15 seconds for 32 seconds, and the difference is significant, and it's the sign for 58 seconds. The MS patients' results are higher than the normal because our target is 58 seconds, but the patient's mean value was 80.34. The healthy control people result was 56.20. And in production test, it is the same. We have the same results. For example, for 7 seconds first assessment, for MS patients, you may see 4.41, the mean result. And in healthy control people, 7.83 seconds. It is near our target, but in MS control, it's very far from the target. And you may see the same results for 32 seconds and for 58 seconds. And the difference between MS and the healthy control people was significant. In that table, you may see difference between total estimation, total production test results, and the target value. You may see the difference between the target value and the MS patients. It was for 7 seconds, it was 5.21, while in control group, it was 0.60, and the difference was significant. We may see the same results for other time duration, and in the production test, we may see that it was different. But I want you to consider that in estimation test, the patient estimated higher value, while in production test, the patient counted lower value than our target. And we wanted to see if there is correlation between estimation and production test in MS patients, and we saw that there is a negative and high value correlation between production and estimation in MS patients. And as a conclusion, we saw that there is an impairment in time perception of patients with MS. So we conducted the Kurzweil-Wallis and the Kikare test, and we saw that smoking, EDSS, number of the attack, and the affected system did not influence the time perception. And our take-home message is time estimation and production is disturbed in MS patients, and cognitive rehabilitation is required in most of them. Thank you very much for listening.